Welcome to today's webinar, Returning to the Workplace, Considerations for Employers. My name is Megan Beal, and I am an associate in Fasken's Toronto Labour, Employment and Human Rights Group. And I'm joined today by my fellow Toronto Labour and Employment associates, Laura Epplett and Lennie Lejasisaks. Before we begin, I have a few housekeeping notes. At the end of the webinar, please click the survey button underneath the video window. These surveys help us to determine future topics, and your input is greatly appreciated. The materials for today's webinar can be accessed via the materials button, also under the video window. We are also recording today's webinar, and the recording and materials will be emailed out post-event. During the webinar, if you have a question, please click on the Submit a Question button to send us your questions. We will do our best to answer all the questions we can. We also received a number of questions before our presentation and have done our best to incorporate those throughout our presentation today. We now have a closed captioning feature as well. If you would like to turn this feature on, please use the closed captioning button designated as CC in the bottom of the video window. If you require technical support, please click the tech support chat button and one of our techs will help you out. If you're looking for COVID-19 specific information, we have a wealth of information in our COVID-19 Knowledge Center, which can be found at fasken.com. Last but not least, our next Labor, Employment and Human Rights webinar will be taking place in September. Please keep an eye on either your inbox or the Fasken Institute section of the website for all of our upcoming events. And with that, we will get started with our presentation. We are going to be covering 6 different topics today. The first topic will be flex work and your workplace. Second topic, we will touch on employee morale, engagement, and the work environment. Third, we'll talk about health and safety protocols and procedures for returning employees to work. Fourth, we'll talk about accommodations and bridging the gap and post-remote work environments. Fifth, we'll talk about constructive dismissal considerations. And lastly, we'll talk about everyone's favorite topic, vaccines. With that, I'll turn it over to Laura to get us started with the first topic.
Thanks, Megan. So let's look at the current situation we find ourselves in. We're more than a year into the COVID-19 pandemic, and to date, we've seen about 1.4 million cases of COVID-19 in Canada. Each province and territory has implemented their own pandemic response, although many have taken influence from each other. And to date, we see that each province and territory is organizing their own vaccine rollout. There are currently 4 approved vaccines in Canada, and rollouts across the country have prioritized higher risk populations, both in terms of age and medical risk, as well as geographic risk as well. On the next slide, we see some statistics as of June 20th, 2021. So as you can see, Canada-wide, about 25 million Canadians have received their first vaccination, and just over 7 million are now fully vaccinated. Now let's look at the 2 most populous provinces. Ontario has just under 10 million individuals who have received their first vaccine, and about 3 million who are fully vaccinated so far. Quebec is quite similar, with about 6 million having received their first shot, and about 1.4 million are currently fully vaccinated. Out west in Alberta and BC, we see some lower numbers, but they have been rising steadily in the last few days. So we have in Alberta about 2.7 million have received their first shot, and in BC 3.5. And in both provinces, we have about 1 million or just under 1 million who have been fully vaccinated. So as we think about the vaccine rollout being in full swing, and now many organizations are preparing for a return to the workplace, let's look at how some of our predictions in the fall of 2020 were on returning to the workplace and where we are right now. So a PwC survey looked at 133 US executives and about 1,200 office workers in December and November of 2020 from a range of different industries. The study overall demonstrated that executives expected to return to the workplace far faster than employees. So as you can see, by July, about 75% of executives anticipated that at least half of the office workforce would be back on site. Now, considering July is next month, this seems to have been an optimistic prediction. And so this compares to about 61% of office workers who expected to return to the office at least half of the time by July. Employee perceptions of the ability to be productive while working remotely appear to have factored into their thinking about returning to the office. So those employees who experienced decreased productivity while working remotely were more likely to envision being back in the office earlier, as opposed to those who reported being more productive during the pandemic. They anticipated a slower return to the office. And in terms of employee demographics, only age stands out. So about 25% of the eldest respondents, those who were 65 years of age and older, said they expected to return to the office at least half of the time by July. At the same time, there was no relation to be noted by job description or gender when respondents made their predictions on when they expected to be back at the office. So now let's talk about flex work and your workplace. So about a year ago, so we're talking pre-March 2020, only a fraction of the Canadian workforce was working from home or remotely. So the typical arrangement was pretty much working 100% from the physical office workspace, with potentially some integration of working from home, let's say either on a special project, or if you had a plumber coming to your house, you needed to work from home for the morning. And some organizations were looking at hoteling. Of course, accommodation of disabilities was always taken into account, but many workplaces were of the mind that outside of any human rights obligation, they were not able to accommodate employees working from home. If we fast forward to today, and during the pandemic period, in many cases, an employer's discretion with respect to working from home was removed, and oftentimes it was required. So many jurisdictions at different times in Canada have mandated or encouraged remote work. So for example, in Ontario, we are currently in step 1 of the reopening, but certain rules still apply. So under Regulation 8220, the work from home except where necessary rule is also in place as well. And that says that each person responsible for a business or an organization that is open shall ensure that any person who performs work for the business or organization conducts their work remotely unless the nature of their work requires them to be on site at the workplace. So this previous position of we cannot accommodate a work from home arrangement may no longer be a practical answer in the future. And we are seeing that employees are increasingly productive while working from home. And of course, while employees or employers are expecting a return to the workplace or are currently accommodating workers in person, there are public health restrictions that should also be followed as well. And so those will be helping with limiting the exposure of COVID-19, and they may include, limiting the amount of staff or visitors that are physically present in the workplace, as well as some frequent cleaning and disinfection of high-touch items, surfaces, and washrooms, to just name a few. So when we're talking about flexible work arrangements, when we're thinking of returning to the workplace, we're thinking not only in terms of location flexibility, but also in terms of schedule flexibility. So when we look at location flexibility, one in particular is continuing remote work, So this would involve, for the most part, employees continuing to work from home and performing their job remotely and not in the physical office. A hybrid model would involve employees doing a split of both working from home and working in the physical office setting. And as well, there are options with either a hybrid model or a complete return to the workplace, to also implement hoteling. So this would include having workers reserve an office or workstation for their in-office days, as opposed to assigning them a permanent workspace. This can cut an organization's office space requirements and then reduce costs as well of operations. On the other hand, when we look at schedule flexibility, we have several options. Flex time is a type of alternative schedule that really gives employees the greater latitude in choosing their particular hours of work, or the freedom to change their work schedules from one week to the next, depending on their own personal needs. So an employee may be expected to work a standard number of core hours within a specified period, but they are allowed the flexibility in their start and end times. Compressed work weeks are another option, where we allow employees to work a standard work week of either 40 hours over 1 week or 80 hours over 2 weeks, but you're working fewer days per week. So it may be that each day that is a work day is extended by an hour or so that employees can have an extra long weekend or have a break in the middle of the week. Among certain demographics, such as those with family status or like childcare or elder care obligations, they may find that a compressed work week works very well for them. And as well, we see employees saving time and costs of commuting by reporting to work fewer days per week, especially if that is reporting to the physical office. Another option is job sharing, which is less of a popular practice. And that would involve having 2 different employees performing the tasks of one full-time position. So each individual will work a part-time schedule, but they will be together accountable for the duties of a full-time position. This may be interesting to an organization that is looking to retain skilled employees and increased employee loyalty and productivity, but this may not work for every organization. The hybrid model, as mentioned, is the most popular model for flexible work that we plan to see as more organizations start to return to the workplace. So this will involve a mix of working from the office and working from home, with potentially a mix of scheduling flexibility as well. And so far, there is no consensus on the optimal balance of work days from home versus work days from the office. And it really comes down to the organization and what works best for them, as well as what their individual employee preference is. So we see several organizations conducted studies in late 2020 and early 2021 on remote versus office work to see where the preferences of North American workers lie. And as you can see, the studies demonstrate that workers are looking for a hybrid work model of either 3 days from home and 2 days from work, or a fairly equal split. And this makes sense given how successful remote work has gone over the pandemic period thus far, coupled with an individual's desire to connect with their team and work outside of their home as well. So I'm now going to turn you over to my colleague, Megan, who is going to talk to you about employee morale, engagement, and the work environment.
Thanks, Laura. So we're now more than 15 months into the COVID-19 pandemic. Obviously, we all know that the pandemic has transformed the way the world works, and in these unprecedented times, business has become anything but usual. The issue is that prior to the COVID-19 pandemic, Canada was already in the midst of a mental health crisis. Pre-COVID-19, in any given year, 1 in 5 Canadians experienced a mental illness, including addiction issues. Now, new data suggests that the mental health issues have become even more precarious, leading some to call the increase in mental illness the second pandemic. Studies from around the world have found that overall mental health has worsened during the pandemic. For many, it's not surprising that COVID-19 has caused or worsened fear, anxiety, and social isolation. The uncertainty around how long the pandemic will last is also a significant factor that contributes to these mental health concerns in our professional and personal lives. Having the office in your house and therefore just around the corner every single day, combined with the fact that most people are glued to their phones and other technology 24/7, has made the separation of work and life nearly impossible. This has caused burnout amongst employees. What do we mean when we talk about burnout? We mean the feelings of intense fatigue, loss of control, and accomplishing nothing at work. So the days, which I'm sure we've all had, where you sit in front of your computer for 10 hours and at the end of the day, you turn it off and you're not sure if you've accomplished anything at all. According to Microsoft's annual trend index, and this was a study that was published in March of this year, high productivity is masking exhausted workforces globally, and the situation is even worse in Canada. A survey conducted of more than 31,000 global full-time employees or self-employed workers suggests that in Canada, more than 47% of workers feel exhausted during a typical workday, compared with the global average of 39%. This index tapped into 31 different markets, polling at least 1,000 workers from each one. Canada's stress levels are also higher than the global average, with more than 50% of Canadian workers reporting feeling stressed. One of the top reasons for rising stress levels among Canadians is the lack of separation between work and personal life. And that came out of a study from Captioning that was published also in March of this year. According to Microsoft, more than 40% of the global workforce is likely to consider leaving their current employer within the next year, with nearly half planning to make a major pivot or career transition in that same time frame. So we know there's a problem, but now we need to look at what to do about it. And this is where it's really important to focus on improving employee morale and engagement. So we've included some examples of things you can do to try to improve employee morale. Obviously, this will be specific to each organization, but we hope that these are some suggestions that you could implement. The first point is to make a point of checking in often. Make people's health and well-being a priority during COVID-19. Set daily or weekly reminders in your calendar to reach out to your team to ask how they're doing both physically and emotionally. And remember that people may be experiencing stress or anxiety about their own health, the health of loved ones, economic uncertainty, and the general state of the world. The second point is to ensure that everyone has what they need to be productive. Having the right equipment to work can help reduce frustration and boost productivity. Ask your human resources department about company policies on laptops, monitors, keyboards, or other necessities. And be sure to share key contact information in case employees need to troubleshoot or if they have tech issues while working from home. Third, encourage virtual bonding or socially distant bonding if that is safe. Obviously, we've all gotten quite used to using virtual platforms like this one to have those virtual connections throughout the pandemic. But as we move towards returning to the workplace, it will be important for employers to make sure that the focus doesn't draw away from remaining engaged with employees. I think there will be a tendency in the next few months to be very focused on getting people back into physical workspaces, but employers should be mindful to not lose those connections with their team while that's taking place. So continuing to schedule those virtual coffee breaks or having a virtual lunchroom where people can drop in if they're available to chat with other members of the team will continue to be very important as we transition back to the workplace. And even when the transition to the workplace occurs, depending on what restrictions are in place at that time, continuing those virtual check-ins will be important. Fourth, it's still important and probably more than ever to celebrate milestones and accomplishments. So aim to share business-related wins with your team on a frequent basis, even if they're small. Particularly if your business has been hard hit by COVID, sharing those small successes with your team will make people feel like they're a part of something bigger than themselves. It's important for employees to know that there are still opportunities available and successes to be had during the crisis. This will not only boost morale, but also increase a sense of connectivity to people while they remain physically distant. And finally, encourage employees to use whatever assistance programs may be available. If you have employee assistance options under your benefit program, sending reminders to employees of those supports and how to access them is a great idea. The other thing that employers can do to increase productivity and promote a healthy work environment is to assist employees with actually establishing those boundaries between work life and home life. So some things that will work for some organizations are not others is you could consider establishing off hours where no emails are to be sent or responded to. So implementing specific rules that you're not expected, for example, to answer emails that come in after 8 p.m. will allow employees to understand that it is okay to walk away and to take some time for themselves. The other important thing is to lead by example. So take breaks and tell your team that you're going to take breaks. Take vacation and tell your team that you're going to do that. If you have the option to sign off early on a Friday, email your team and encourage them to do the same. These small things that will allow employees to see that the leaders are also taking breaks will demonstrate that it's okay to need mental health breaks during the workday, to be frustrated, and to need a healthy balance between work and home. Some other ideas that may work, again, for some organizations is to have a no camera on policy, set calls where people understand in advance there's no expectation to appear on video. Some institutions have instituted walk and talk policies where people are told in advance they won't have to have their camera on and can use the time to get some physical activity and walk while taking the call. Consider if you can have no Zoom meetings or no video calls on Friday, maybe no meetings on Friday, if that works for your organization. And some employers have even given employees some additional paid time off. As I'm sure we've all heard from reading newspaper headlines and watching the news, reports of racism and discrimination towards Asian Canadian populations have sparked since the beginning of the COVID-19 pandemic. Employers have to keep an eye on this in a virtual world or as people return to the workplace. Employees who have had or are perceived to have had COVID-19 may also experience discriminatory treatment. And so both from an employee morale perspective and a health and safety perspective, it's imperative for employers to protect these employees from discrimination and harassment. You can do this by making sure that your workplace violence and harassment policies are readily accessible to employees, make sure those policies are up to date, make sure people have been trained on the policies, and if you are experiencing particular issues in the workplace, consider refresher training. I'll now pass it over to my colleague, Lennie.
Yes, thank you very much, Megan. I'm going to be speaking to some general health and safety protocols and procedures that employers will want to take in their workplace. For employers who've never sent their employees home and have continued to operate with people working in person, many of these will be a reminder. But if you have a virtual work environment currently and are returning to the workplace, there's many considerations here that you want to take note of. And as we go through, potentially develop some policies or refresh yourself on your local public health guidance, as that's a key factor. So as a reminder, under all health and safety legislation across our province and federally, employers have a general duty under all health and safety legislation to take every precaution reasonable in the circumstances for the protection of workers at the workplace. In many cases, there's industrial regulations that specify certain regulations depending on the type of work environment. COVID is obviously a novel disease or virus, and so there's not necessarily any specific health and safety guidance passed in the legislation yet. Certainly, there's individual emergency response legislation in many provinces, but it remains to be seen whether there'll be any specific legislation relevant to COVID in the future. However, the general duty clause, as it's all often referred to in health and safety legislation, that requires employers to take all reasonable precautions, covers the fact that an employer must follow public health guidance. At least the public health guidance is a floor. So if you have people working in person, you're going to want to consult your local public health unit or provincial government guidance on what steps need to be taken for in-person work, because that will be the minimum floor that's expected under the health and safety legislation. And I said that's a minimum floor because of the fact that you might be required to go above and beyond that floor depending on the type of work environment or business you're operating. Obviously, if you operate a type of business or organization where people can easily distance, 6 feet or more, 2 meters, you can appropriately mask, wear PPE. The floor might be good enough in terms of what you're meeting. However, if you operate a work environment where, such as a hospital or a healthcare institution, where you're dealing with very vulnerable people, the type of standards expected in terms of PPE and policies and protocols in place will be definitely heightened. As it relates to the individual workplace that people are working in when they're working remote, it depends on the individual provincial legislation. So in British Columbia, for example, somebody working at home, their home is considered the workplace. However, here in Ontario, it's a little grayer whether somebody's workplace is considered to be their home under the occupational health and safety legislation. So you should get individual guidance based on your particular province in terms of people working remotely and the health and safety implications that come from it. I will mention, though, generally that from a risk management perspective, I personally feel like it's pretty safe working from home. Somebody is unlikely to have significant hazards in their house, because they live there every day. However, I think we might potentially see a rise in repetitive strain injuries, perhaps because people's work from home setups are not necessarily as good as their office setups that they had previously. They might have cobbled together work from home arrangements at the kitchen table originally with an uncomfortable wooden chair. And hopefully, as the pandemic has gone on and they've continued to work from home, they've upgraded their office furniture. I know I've personally seen on the news many times that there was a shortage of office furniture, for example, at IKEA for a while. So as an employer, I think with people working from home, the risks obviously are low because the house is typically a safe environment. But what you might want to specifically consider is ergonomics, whether you've supplied office furniture or some kind of health and safety checklist. That would be very useful to people working at home just to eliminate any hazards, particularly around creating a healthy ergonomic environment where repetitive strain injuries are possible. Next slide, please. So if you eventually decide to bring employees back, which I think we're having these discussions now, I mean, we're hearing more and more restrictions being lifted every day. So the possibility of people returning in person to the workplace for non-essential work environments is increasing every day. More people are getting vaccinated, as we've already mentioned earlier in the presentation. The chances that public health restrictions lift is likely late summer, early fall, I think for sure to a significant degree. So as an employer, you're beginning to plan, what does returning to work in person actually look like 15, 16 months originally after you might have sent people home. So if you're considering bringing people back, our recommendation is a phased return. So, you might want to come up with a return to work plan. Many organizations we've heard from have conducted surveys from their employees, basically. So what do people want when the office reopens? Do they want to work 5 days a week? Do they want to work 3 days a week? A hybrid arrangement where there's some flexibility. So you might not want to consider bringing 100% of your employees back on day one. You might want to consider only those that are the most essential, returning those first, and then a month later or several weeks later, bringing back the next phase, and so on and so forth. Many employers who have gone to a predominantly work from home model have had to have people still go into the office because certain functions can only be done in person still, depending on the type of workplace. However, you could also do it on a voluntary basis, ask people what they're interested in. That way, people that are still uncomfortable with returning in person might be able to extend working from home for several more months. And the people keen to get back in the workplace, they might jump at it and say, yeah, I'm happy to return home. I've got 5 kids at home. They're driving me crazy. I want to go back to work right away. So it's really an individual question. And I think working with your employees to plan a phased return to work will probably be the most successful. For many people, if they've been working at home for this long, they might be scared to return to work in person, right? That might involve a commute on public transit again, busy public transit. And so part and parcel with that return to work, there's many other considerations that need to be factored in, such as children, virtual learning. We don't yet know necessarily what schools look like next September. Things like what safety protocols will occur on public transit, childcare arrangements. So there's a whole bunch of other factors that you might want to consider when you do a phased return to work. And then, I think this will help employees become more comfortable. It'll also help you from a legal risk management perspective with tweaking your policies. Public health guidance is going to continue to evolve. Vaccination rates are increasing. We anticipate public health restrictions will slowly be lifted. So if you conduct a phased return to work, that'll also give you a good ability to evolve your own plan over time as things continue to evolve. Next slide, please. So if you haven't already, one of the key things you need to do as part of your health and safety considerations upon reopening is create physical distancing policies. I think everybody in the world, or at least in Canada right now, knows what physical distancing is. We've also, originally we were using the term social distancing, but that had a bit of a negative connotation because we still want to obviously promote people socializing, just not 6 feet, just not closer than 6 feet. If you haven't already, you definitely need to consider creating a physical distancing policy that lines up with your public health guidance. So simply put, any policy is going to state people need to remain 6 feet apart or 2 meters and wear masks and things like that, depending on the PPE that's required at the current time. Where you want to pay particular attention to is in workspaces where people might not be 6 feet apart. So as part of your reopening plan, consider if you have desks that are very close together, what does that look like? Are you going to create plexiglass barriers? How are you going to keep people 6 feet apart? Can you rearrange your office? What steps can you take? And of particular note is that areas that employees will be unmasked in, so such as cafeterias, lunchrooms, and potentially meeting rooms if you're eating in those, you need to have clear rules and guidelines about what employees can and can't do when they're unmasked. So for example, we've seen some cases that require almost enforcement of lunchroom meeting spaces to ensure employees are physically distanced when they are eating because they're unmasked. And as soon as they're done eating, they need to put on a mask right away and stay 6 feet apart. So lunchrooms are a key focus of any health and safety inspector as well, given the risk of transmission when people are unmasked is that much more heightened. In your physical distancing policy, you'll also want to clearly specify who your employees should interact with and how they interact with. So, if they're interacting with customers, suppliers, patients, visitors, what kind of PPE do they wear? What are their expectations? Also, to consider how do you want your customers and suppliers and visitors on your site to behave? What are the expectations around them? In many provinces, if you're operating a business and you're open to customers, you have to have screening in place for those customers to turn away anybody with symptoms. And you have to ensure that they're wearing a mask. And if they claim that they have a mask exemption, you can take certain steps, although not necessarily demand proof of those mask exemptions. Lawyers often like to say that, you need to reduce these things in writing, and it's for good reason, because everybody needs clear expectations around physical distancing, especially when it's mandated by public health. Next slide, please. So one of the key things too that we've seen implemented by public health, and if you're already an employer who's reopened, this won't be a big deal because you already have a daily screening process in place, very likely. But if you have employees coming back to work for the first time after being virtual, you're going to want an active daily screening protocol in place. So many governments have tools that you can adopt that are endorsed by public health that list, for example, the COVID symptoms, and employees have to check those off if they have any of them, or if they've traveled within the last 14 days, for example, or if they have a family or household member who has COVID symptoms. In many jurisdictions, public health requires family members of people with COVID symptoms to also self-isolate pending a negative COVID swab or until there's an alternative diagnosis or something along those lines. So you're going to want to be on top of your public health restrictions and what your screening protocols are. You can also create your own self-screening. There's many vendors selling screening apps, for example, on a cell phone. An employee can go to a link. It makes it very easy to just boom, click the questions. No, I don't have any symptoms today. No, I haven't traveled. No, nobody in my family has any COVID symptoms. Okay, the screening says, yeah, you got a green check mark. You're okay to go to work. Or if you say, look, I have a really sore throat, I am extremely tired, and you mark those as symptoms, the screening tool will fail you and say, do not come to work. It also might alert your employer that you failed the screening, so that if you show up and the employer validates the screening at entry, they're obviously going to turn you away. And the reason I called this originally active self-screening is because it's not necessarily just enough under our health and safety legislation to say, yeah, we've asked our employees to self-screen every day, you know, only people showing up should be clear. As an employer, you have an obligation to ensure that the screening is completed before the employer comes into the workplace, because it's keeping the employee healthy, but it's also keeping your other employees and customers healthy as well. So if you haven't already, develop a daily self-screening protocol and communicate it to everybody. Make it easy to do, right? This isn't complicated. There's a lot of public health guidance. There's a lot of templates out there already. There's in fact online screening developed by the government for workplaces that you can use. So it's not necessarily expensive, but develop a clear protocol and establish expectations with your employees to do the screening and a way to validate the screening every day before they arrive at work to make sure everybody coming to work is healthy. So building on this screening slide, you need a procedure for reporting illness. So if an employee fails the screening, what do you do next? Does the employee just stay home? Who do they tell? You're going to want a detailed protocol that's simple enough for employees to follow to say, if I fail the screening or I'm not feeling well that day, what do I do? So do they phone their boss? Do they phone their manager? You know, and phone in sick basically. What happens though if an employee develops and tests positive for COVID? What do you do then? You're going to want a protocol in place to determine who that employee interacted with, any contacts they've had of customers, clients, suppliers, other vendors, because you're going to want to work with public health to say, okay, what do we do? We've had an employee test positive for COVID. They were perhaps in the workplace 3 days in a row. They obviously didn't have any symptoms, so they were asymptomatic, but they have COVID now. We don't know if they got it from community transmission, you know, somebody at home, or did they get it from somebody else in the workplace somehow? So you're going to want a protocol to address how you deal with an employee testing positive for COVID. And that doesn't mean they got it from the workplace, but nonetheless, you have an obligation to investigate. You're probably going to want to work closely with your public health department, who will have a process in place, and they'll conduct probably contact tracing and give you some guidance in terms of next steps. You know, we've seen certain employers that had outbreaks in their workplace. So depending on your jurisdiction, that could mean 2 or more cases that are acquired in the workplace. And public health has implemented specific measures for those employers to take. Obviously, if you can avoid having an outbreak, that's key. You want everybody to be healthy, and it's not necessarily great reputationally to be in the news with an outbreak. You know, how do you report positive tests? Do you report positive tests, or is that the employee's obligation? You need to be clear about these requirements. So again, reduce it to writing, communicate it out. It doesn't have to be complicated. It just needs to be very clear for employees to follow, so that everybody's on the same page, and that you don't have somebody that accidentally doesn't show up to work one day, test positive for COVID, and you don't know about it till 2 or 3 days later, because you may want to work with public health and tell those other employees that came into contact with that employee to self-isolate. Next slide, please. So personal protective equipment, masks, everybody's favorite topic that we're all well familiar with at this point in the pandemic. Likely masks are mandated in your jurisdiction still. I think there's very few areas where mask mandates have been lifted yet. Some mask mandates I've seen have been lifted for outdoor close contact, but other than that, it seems like most mask mandates are still in place. I will note that if you haven't seen on the news, it looks like Alberta on July 1st is lifting all COVID restrictions. That's based on the news from a day or two ago. So it looks like as of July 1st, Alberta is saying you don't necessarily need a mask indoors anymore. That might still be contingent on people being vaccinated or whatnot, but that looks like the first big shoe to drop, if you will, when it comes to public health restrictions being lifted. I think in most cases, people will be wearing masks for quite some time because vaccinated people can still transmit COVID if they're positive, or they can still get COVID. It's just obviously less severe. So we're likely to see mask mandates in workplaces, particularly where people can't distance 6 feet for probably several more months, if not more at this point. If you're an employer, we've seen a bit of debate in the media about surgical masks. Those are medical grade masks versus cloth masks and their effectiveness. We've seen at the beginning of the pandemic, we'll all remember people were making homemade masks out of things like t-shirts and other things like that. And the science quickly developed on that and said, no, you need 3-layer masks or 2-layer masks with a filter in them. As an employer, you may want to supply PPE to employees. So if employees are coming to work every day, you may want to say, look, we have level 1, level 2 medical grade masks. And that's just to ensure consistency, because if you allow employees to bring their own cloth masks, you don't necessarily know what they're wearing, right? It could just be a sort of a homemade cloth mask of just an old cotton t-shirt or something like that, where at least if you source medical grade masks or something similar, you can be assured that the quality is there. And so it's largely about coming down to a cost benefit decision. If you want to supply PPE, in some cases you would be obligated to supply PPE depending on the nature of your organization and the type of their job. But depending on whether people are regularly coming into contact with other employees or your patients, visitors, clients within 6 feet, they might need eye protection, in some cases gloves, obviously perform good hand hygiene. And obviously keep an eye on your public health guidance over the next couple of weeks and months, because I think guidance around PPE seems like it's changing rapidly as more people are vaccinated. The science seems to be good in the favor of vaccines, drastically reducing the rates of COVID, but is that enough for public health authorities to remove mask mandates? That remains to be seen. As an employer, with your general duty clause to take every reasonable precaution, you don't want to be out in front of removing mask mandates in the workplace until public health guidance is very clear that it's safe to do so. And with any policy, particularly around, if you require employees to wear PPE, you need to train them. So how do you put on a mask? How do you take off a mask to prevent cross-contamination? How do you dispose of gloves? So all these types of things are very important to consider as you're developing PPE policies or updating them. And of course, some other health and safety considerations to take into effect, disinfectant cleaning. Have you upped your cleaning schedules? Have you worked with your building providers to make sure that the areas are safe? Have you measured off your meeting rooms to say, look, this meeting room used to fit 20 people with chairs side by side. We've measured off all the spaces now. It only accommodates 6 because we've put markers on the floor to distance spots. Things like elevators are obviously contained spaces, and your building provider, or if you own your building, might mark off the spaces to say, look, elevators only fit 2 people at one time, or 3 people, or depending on if they're wearing masks, maybe it's more people. So all those types of considerations. And if you're bringing people back and you had an open concept office where people were closely together, does that impact your physical layout? And then, of course, if you're a business engaged in air travel or train, to visit clients, or your employees are often on the road, what are the latest guidance for travel? We've seen that on July 5th, the federal government is going to lower the travel restrictions for people that are fully vaccinated. So you don't have to quarantine anymore or stay in a hotel pending a test result and get a test result at day 8. So those are for people that are fully vaccinated. So you're going to want to stay on top of all the public health guidance, because it's changing rapidly, but also it specifies what you need to do as an employer, depending on your type of business. So I'm going to turn it back to Laura right now, who's talking about accommodation.
Thanks, Lennie. So even though employees are working remotely during this pandemic, an employer continues to be legally obligated to accommodate their needs in a timely manner when they stem from one or more prohibited grounds of discrimination. This is either under the Federal Canadian Human Rights Act or under any provincial human rights legislation. And when an employee requests an accommodation, and that request is related to a prohibited ground of discrimination, it's the organization's duty to follow the appropriate steps to ensure that the duty to accommodate is met. And this is still in place currently. So as you will see, there are several steps in the accommodation process, and we are going to take you through each one. Be aware that the duty to accommodate has both a procedural component involving the process, as well as a substantive component involving the accommodation provided. The procedural duty will involve considerations, assessments, and the steps taken to respond to the accommodation requested. A failure to give any thought or consideration to the issue of accommodation, including what, if any, steps should be taken, will potentially constitute a failure to satisfy this procedural duty to accommodate. And the employer must seriously consider how it is going to accommodate the employee through a meaningful process. The substantive duty is looking at the appropriateness or reasonableness of the chosen accommodation, as well as the reasons for not providing an accommodation, including proof of undue hardship. So the guiding principle in the law of accommodation is that an employer is required to accommodate the needs of an employee up to the point of undue hardship. The law of undue hardship involves a very high threshold of a variety of factors, and they are usually looking at considerations such as financial hardship, security, health and safety, and other practical constraints. In determining what is in fact undue, the case law is clear that both employers and employees must work together to find a solution. And they both must be open to a variety of measures. An employee cannot insist on their preferred accommodation or on a perfect solution. And the employer must consider a wide range of options and be able to demonstrate that multiple accommodation options were considered in order to meet its obligation under human rights law. So when identifying the need for accommodation, make sure you are aware of which ground or grounds of discriminations are covered by the request. So these will be captured as mentioned in either the provincial or the federal human rights legislation, depending under which jurisdiction your workplace falls. As well as explained, this will involve both the procedural duty and the substantive duty, and both are necessary in order to meet the duty to accommodate. The next step will involve requesting supporting medical documentation if it has not already been provided by the employee. This may also involve assessing other relevant information, such as public health considerations, like the current COVID-19 cases in the community while employees are returning to work, as well as vaccination rates. And as we've said, everyone must take part cooperatively in this process of accommodation. The employee must answer questions and provide information about their relevant restrictions and limitations, but the employer must limit their requests for information to those that are reasonably related to the nature or limitation of the restriction, and in order for them to respond to the accommodation requests. It is not an employee's responsibility to answer any and every question with respect to their accommodation. And please remember, requesting an employee's diagnosis is not usually appropriate. On the next step, the organization and the employee must consider different accommodation options. We've listed a few, but there are many to consider. So this may look at time off work, such as a leave. If you have returned to the office, this may involve a remote work accommodation, and this is especially a consideration now for an employer to consider, given that many organizations have been successfully working from home. So whereas they may have said beforehand that this was not something that they feasibly could accommodate, this will be very difficult to establish now. This may also involve flexible scheduling, changes in working conditions, such as the location or office environment, as well as potentially modifying job duties. And there is no set formula for accommodating employees. Each employee's needs are unique, and must be considered afresh when a new accommodation request is made. So what might work for one employee may not work for others. And a solution may need to change over time. And it's important to revisit those accommodations to make sure that they continue to meet an employee's needs appropriately. Where an accommodation is made, employers should communicate the accommodation to the manager if appropriate, set some timelines to evaluate the effectiveness of the accommodation and how well it's progressing. Allow time, however, for the employees, their coworkers, and their managers to adjust to this accommodation. Be prepared and flexible to make certain adjustments, and sometimes they may be necessary to go back and get further medical clarification. And keep the employee in the loop if this accommodation will be changing or ending. With respect to COVID-19, in Ontario, we see that the Ontario Human Rights Commission announced that COVID-19 will be considered a disability, meaning that it will be afforded protections under the Human Rights Code. BC's Office of the Human Rights Commissioner has also adopted a policy position that COVID-19 is a form of disability under the law, as it is a medical condition or perceived medical condition that carries significant social stigma. But we still know very little about the long-term implications of someone having COVID. In most cases, an employee with COVID will be off for a few weeks and be able to recover during that period. However, if they experience complications, which may or may not be due to other underlying medical conditions, this would need to be accommodated similar to any other medical issue. In the normal course, the duty to accommodate is raised when an employee has a disability that impacts their ability to carry out their regular job duties. Employees who are more vulnerable to COVID-19 present a different scenario. Their underlying medical condition and or age may not in themselves be disabling. However, they may have a longer period of illness should they contract COVID-19 if they're within a vulnerable group or at risk of permanent health effects or even death. As we've seen, Statistics Canada has found that people with pre-existing chronic conditions or comprised immune systems are at a higher risk of dying from COVID-19. In 100% of the COVID-19 involved deaths of Canadians under the age of 45, they had at least one other disease or condition certified on their medical certificate of death. And now the proportion of this number decreases with age, which had dropped to 93% for those between 45 to 64 and 89 for those aged 85 and older. And if an employee is staying home on the advice of a medical professional, this may also need to be accommodated by the organization. And there may be potential liability to an employer if the employee is in a high-risk category and is forced to come to work and then does contract COVID-19 in the workplace and suffers medical conditions as a result. As we've seen, the older populations are particularly vulnerable to COVID-19. And so employers have a duty to ensure the safety of all employees, including those that are in this elder population. This may mean accommodating work from home arrangements or leaves of absence for older employees, even if the employer's workplace remains open. But again, this will be on a case-by-case basis, depending on the circumstances. Family status protection in the COVID-19 context does come up a lot and may be engaged in the following circumstances, such as an employee's childcare obligations or an employee who resides with or cares for an at-risk family member. And some of these high-risk groups include persons who are immunocompromised, who have heart disease, hypertension, chronic respiratory disease, etc. So there have been some very common family status obligation questions that have come up during this time. So we thought we would answer a few now. So one that we've received is, how should an employer respond to employees who need to stay home to care for an ill family member? So with all accommodation requests, they should be considered on a case-by-case basis. And depending on the province, this employee may be entitled to statutory leave of absence under minimum employment standards legislation. Where an employee either does not qualify for a leave or has exhausted their entitlement, accommodations under human rights legislation then must be assessed. And this would be triggered by the family status protection under the code or the relevant legislation. An employer can also not terminate or discipline an employee for taking a leave if it is captured by the human rights legislation. Now, we also have, what if an employee requests to work from home because they have an at-risk family member? So they're not exactly caring for them, but they want to be home because they are afraid of exposure. So as we've mentioned, it's always going to involve a case-by-case basis, and it will have to take into account all of the circumstances, including the nature of the family member's illness, the employee's relationship to that particular family member, and what measures have been implemented at home to prevent the transmission of the virus. We recommend that an employer's COVID-19 safety plan should also be reviewed, as it may adequately address the employee's concerns. It may be that they have certain questions or concerns with respect to returning to the workplace if they have an at-risk family member at home, but this may be remedied under your policy. So I'm now going to turn this over back to Megan, who is going to talk about constructive dismissal considerations.
Thanks, Laura. So a constructive dismissal occurs where the fundamental terms and conditions of an employee's employment are changed unilaterally, without notice, and without the employee's consent. The key there is that the changes are unilateral. So if an employee agrees with what the changes are, a constructive dismissal won't be triggered. However, I'll caveat that to say that it has to be actual agreement. So telling employees this thing is happening to you and you must agree, to force their agreement is not going to be sufficient agreement to a change. When a constructive dismissal occurs, an employee is entitled to treat their employment as having been terminated. This will trigger entitlements to pay in lieu of notice, and depending on what the employee's circumstances are, the law that applies, employment contracts, and common law, those entitlements will differ employee to employee. There's a number of different types of changes that could constitute a constructive dismissal. So changes to an employee's position could constitute constructive dismissal. This could involve the addition of duties and responsibilities, the removal of duties and responsibilities, title changes, changing in reporting relationships, demotions. Changes to an employee's work location could constitute constructive dismissal. We'll talk about that in a lot more detail at the end of this section. Changes to an employee's compensation, so decreasing an employee's salary, removing extra entitlements to bonuses, STIP, LTIP participation, those types of things, and laying an employee off in the absence of a right to do so under an employment agreement will also trigger a constructive dismissal. In some cases, a single change in and of itself can constitute a constructive dismissal. In other cases, a bunch of small changes that wouldn't otherwise be constructive dismissal will add together to constitute a constructive dismissal. If an employee does not agree with a change, an employer can provide notice of the change to try to mitigate against a claim of constructive dismissal. The amount of notice that would need to be provided, again, is going to vary employee to employee based on the employee's age, their length of service, what their position is, and it may be impacted by if they have an employment agreement and what it says about that as well. So I apologize to our viewers that are outside of Ontario. My next couple slides are going to be very Ontario focused, but highly relevant for those that are in Ontario, but bear with us. I promise we'll get back to more generic principles at the end of this section. So in Ontario, what we saw during the pandemic is actual changes to the Employment Standards Act to address constructive dismissal issues. So in May of 2020, the Ontario government issued a new regulation intended to adjust termination liability under the Employment Standards Act to deal with the realities of the COVID-19 pandemic. In June, this regulation was amended to extend the COVID-19 period to September 25th of 2021, and designated diseases under the regulation include COVID-19. This effectively means that as of September 26, 2021, at least the way it's currently drafted, the regular rules around constructive dismissal and temporary layoffs under the ESA will resume. But for now, we're still operating with these amended rules. What happened in the regulation is the Ontario government put into the legislation that employees who do not perform their duties because their hours of work have been temporarily reduced or eliminated by the employer for reasons related to COVID-19 are deemed to be on an infectious disease emergency leave. This means that any employees that would have otherwise been constructively dismissed pre-COVID-19 are actually put on a job protected leave under the legislation instead. The regulation went on to specifically say that a temporary reduction of an employee's hours of work or wages for reasons related to the designated infectious disease, which includes COVID-19, does not constitute constructive dismissal under the Employment Standards Act if it occurs during the COVID-19 period. So that period between March of 2020 and September 25th of 2021. With the introduction of this regulation, there were a lot of questions about what this meant for an employee's common law entitlements. As you probably know, we've got two different buckets of entitlements in Ontario. We've got an employee's entitlements under the legislation, and then common law unless they've got an employment agreement that says something else. So we were very unclear about what this meant for those common law entitlements and whether constructive dismissal claims could still proceed for common law. In April of 2021, we got some interesting guidance from the Ministry of Labor. They updated their guide to the Employment Standards Act to add a little note, which we've circled on the slide there, to say that these rules affect only what constitutes a constructive dismissal under the Employment Standards Act, and these rules do not address what constitutes a constructive dismissal at common law. So they specifically said this only applies to ESA and we're not commenting on common law. Notably, these changes weren't made in a regulation. They were made in this guide that interprets the Employment Standards Act. So it can be debated what impact that actually has, but it again raised these additional questions about what would constitute constructive dismissal at common law. And then we got our first case from the courts in Ontario. So in Cotonou, an ocular health center, which was released in April of 2021, in that case, the plaintiff was advised that she was being placed on a temporary layoff due to the closure of the clinic during COVID-19. She commenced a civil action directly after and sought damages for constructive dismissal. The court was asked to determine whether this constituted a constructive dismissal. And the court distinguished between constructive dismissal under the Employment Standards Act and constructive dismissal at common law. The court found that while the regulation precluded a claim for constructive dismissal under the statute, it did not take away or otherwise have any effect on the plaintiff's ability to pursue a claim for constructive dismissal at common law. In support of this interpretation, the court referred to the publication that we just looked at, where the government said that it didn't impact the common law entitlements. And on that basis, the court found that the employee, in fact, had been constructively dismissed. However, it was short-lived, and if we can go to the next slide. In June of 2021, we got another decision from the same court finding something very different. In Taylor and Hanley Hospitality, the same Ontario court found that an employee that was laid off and put on the infectious disease emergency leave and then recalled, in fact, had not been constructively dismissed. The court found that the prior decision that we just looked at in Cotonou was wrongly decided. And the court specifically said that an employee cannot be on a leave of absence for ESA purposes and yet be terminated by constructive dismissal for common law purposes because it would lead to an absurd result. The court ruled that the regulation can and did change the common law in Ontario. And in the circumstances, employees are not laid off, they're not constructively dismissed, they're just put on a statutory leave of absence. So what this leaves us with is two decisions from the same court with conflicting results. We don't know at this time if this most recent case will resolve this conclusively or if we'll see further litigation to try to figure out which decision is actually correct. It also leaves us with the same amount of uncertainty that we had in every other jurisdiction outside of Ontario because the court's decisions were tied directly into interpreting this regulation under the Employment Standards Act, and we're not making comments more generally about constructive dismissal principles. We've not yet seen any cases from other jurisdictions about constructive dismissal during COVID-19 to have any insight into what courts might decide. So switching gears a bit from that case law, and now we'll talk again about things that are more broadly applicable to all jurisdictions. One thing that has come up a lot during COVID-19 is shifting employment locations, and we'll talk about a couple of different scenarios of how this may come up. But employers who have decided to relocate during the pandemic should be aware that shifting to a new location can create a risk of constructive dismissal if employees will be required to commute to that new location upon returning to work. When determining whether a constructive dismissal has taken place, a court is going to look at first the employee's employment agreement to see whether the contract allows the employer to move locations. So some contracts are written to say the employer can change your work location and it doesn't constitute a constructive dismissal. If you've got something like that, you're probably pretty safe. However, if you have a contract that is silent, or worse yet, actually sets out the person's designated work location as being a specific address or a specific city, you're very likely going to find yourself with some constructive dismissal problems if you've now moved the office and it's, hours away from its prior location. The other issue is the case law is not particularly clear about what the threshold is for triggering a constructive dismissal. So we've got some cases that say moving an office 2 hours from its previous location wasn't a constructive dismissal, and others that say moving it a much shorter distance actually was a constructive dismissal. So this would need to be assessed case by case, and you should start by looking at those underlying employment agreements to see what flexibility you have to move in the first place. Two other changes that are likely to occur post-COVID-19 are permanently requiring employees to work from home or requiring employees to return to the workplace. So requiring employees to work from home permanently, and we expect many employers may actually have found during COVID-19 that it worked quite well to have employees work from home, and you may just want to keep them there, but that could constitute constructive dismissal for the same reasons that we've looked at on the previous slide. If an employee was offered employment and again was provided with an office location in their offer letter to say that that is where they would be working, employees generally would not have had any expectation that they could be required to work from home full time. Further, if the employers made representations that the employee would work at a workplace and wouldn't work from home, or that this working from home during COVID-19 would be temporary and they would later return to the workplace, employees may allege constructive dismissal if they're told to continue working from home. On the flip side of that, requiring employees to return to work in some situations could also constitute a constructive dismissal. This will be particularly notable for employees that were hired during COVID-19 that have never worked from a physical work location. If those employees, again, you'll want to look at their offer letters, were told you will be working remotely and there was no clarification about only during COVID-19 or at some time in the future that might change, you may actually be contractually bound to continue to allow them to work from home. So you'll want to, again, review specific offer letters to see what representations were made to employees. When you are thinking about returning employees to the workplace, as we've gone over, you'll want to consider a staggered return to work to allow employees to adjust. So for example, allowing employees to come back 2 or 3 days a week rather than full time. And also you'll want to be sure to provide employees with enough notice to allow employees to make arrangements to return. If employees have childcare obligations, or perhaps they themselves have moved and are now further away from the workplace, they may need more lead time to get everything in order before returning. So it's not going to be enough to call someone on Friday afternoon and say, please return on Monday morning. We're going to need to be giving employees as much notice as possible prior to returning. Now, 2 very common questions we got in advance of this presentation that we wanted to briefly address. I'd say probably the number 1 question we got is whether you can actually require people to return to work. So this is a bit of a it depends answer, unfortunately, but first you're going to want to consider if there is any public health guidance like there is in place in Ontario now that requires you to continue allowing people to work from home. Assuming there is no public health guidance that suggests you have to allow people to work from home or that it's recommended that they work from home, the next thing you want to look at is your duty to accommodate. So is the person saying they can't return for some kind of health reason or a family obligation that may trigger an obligation to accommodate under human rights legislation? If not, then you also want to consider from an employee morale perspective why the employee is saying they can't return. And then you can consider whether you can require them to return. If the employee is continuing to refuse to return, you could start to manage the employee in the context of a job abandonment and send them warning letters that they are expected to return. But again, this will be highly fact specific depending on the reasons the employee is giving you for failing to return. We also got a lot of questions about employees working elsewhere. So they've moved out of the province, out of the country during COVID-19 and haven't returned. And here, again, it's going to be very fact specific. We're going to need to look at whether they told you they were moving, whether you later found out they moved, what you did about it in response. We could find ourselves getting into situations where an employer could be to have condoned or allowed that to happen if you knew months ago that they moved and didn't express that that wasn't okay. There's a lot of issues around this, so it would be outside the scope of this presentation to really go into all of it, but we'll just flag it for you briefly to say that you would need to look at what employment standards even apply to a person if they were hired in Ontario and they've been working in BC. Arguably, BC employment standards may apply to the person. There are a lot of tax consequences associated with that, so it is a very complex issue. And with that, I will turn it over to Lennie to talk about vaccines.
Thanks a lot, Megan. So how about those vaccines? So the topic that keeps on giving when you click on the TV, it's all over the news every day. Pfizer, Moderna, AstraZeneca, all the different vaccines. I think originally when we heard there was vaccines being rolled out, I don't know, 5 or 6 months ago when that news first arrived, we thought, okay, things are going to return to normal. Well, not so fast. The vaccines were reaching a more of a critical mass right now, but it doesn't look like it's going to be the end of masks or physical distancing just yet. I mean, besides Alberta starting June 1st, but certainly it looks like many of the public health measures that are currently in place will remain in place to some degree, at least indoors for quite some time. But we're doing really well from a vaccination perspective across the country. I just looked up some recent numbers yesterday. We're doing 300,000 vaccines a day, doses of vaccines. That's great. That's just less than 1% of the country getting at least 1 dose every day. As it stands right now, we've got 2/3 of the country with at least one dose. And that's if you take out children, obviously, because the vaccine is not approved for them, 76% of people eligible across the country have at least one dose. That's incredible. And roughly over 20% of people are fully vaccinated. So Dr. Teresa Tam did mention a little while ago, she's our chief public health officer for the federal government. She said, you can really expect public health restrictions to start rolling back when we achieve 75% of the country having one dose and 20% being fully vaccinated. So we're really getting to those numbers right now. It does remain to be seen, though, what public health measures will be rolled back and when and how they'll do that. We can assume it's going to be gradual, but right now, if you're an employer, you're probably maintaining status quo when it comes to public health measures. So things like PPE, physical distancing, and remote work arrangements will continue, even if you're allowed to roll things back. You know, we suggest taking a gradual approach to gauge the temperature of employees, get your policies in place, test them, roll them out gradually just to ensure they're successful. There will be anxiety around return to work. And as well, too, this will largely depend regionally. How well is your province or your specific city or area doing when it comes to vaccines? You know, yes, those numbers are Canada-wide, but we still don't know exact numbers regionally. So you might be in an area that's knocking this out of the park and is fully vaccinated, or you might be operating workplaces in an area that is much slower to get the vaccine. So keep that in mind. It's very context specific. Next slide, please. So one of the big questions we're receiving is, can I ask an employee if they've been vaccinated? And the answer to that, again, is you might. However, you're going to want to do a bit of analysis, and I would suggest seek some legal advice, because vaccination status is personal health information in many provinces. So privacy legislation, you have federally PIPEDA, and each province has their own privacy legislation, or it picks up the federal legislation. So you're going to want to keep in mind that somebody's vaccine status is personal health information, similar, you know, whether they have any medical conditions. So it's not something you're going to want to necessarily collect unless you actually have a reasonable purpose. And when we talk about reasonable purpose, that would look at, okay, what type of organization or employer are you? A healthcare organization would definitely have a reasonable purpose because they're working with vulnerable people, particularly if they're seniors or at-risk groups, to know whether somebody's vaccinated, because that might change whether they can work with those types of groups. Or if there's an outbreak at a hospital, you know, their vaccination status might depend on, might impact how those outbreaks are handled. Although right now, my understanding is that public health guidance doesn't necessarily differentiate between somebody who's been vaccinated and not vaccinated when it comes to self-isolation, depending on an exposure. So we're still in the early days when it comes to public health guidance, really making distinctions for vaccinated versus unvaccinated people for the most part. And then it needs to be reasonable in the context. So again, a lot of what we talk about today is context specific. So while we would like to paint with a broad brush and give answers, you know, right off the bat for a lot of things, a lot of it does boil down to an analysis of your particular organization, your region, what public health measures are in place there. Do you have employees working on site or remote? If you're 100% remote still and plan to be for the next 6 months, it's probably not reasonable to ask your employees their vaccination status, because if they're not coming back to the workplace, you know, what does it matter? Why do you need that information? And generally, my advice would be, don't collect more information than you need. You know, as an employer, you don't want to be sitting on troves of personal information, or in this case, personal health information. You want to really limit the scope of the information you're collecting. One thing, though, I will say is really collecting vaccination status is a balance, right? We're balancing the employee's privacy rights with your obligations as an employer under the health and safety legislation to keep everybody safe. So you're balancing somebody's privacy rights versus your general obligation to keep all employees safe. And so as you're going through this analysis and asking yourself, do we want to collect this information? Go through this checklist to say, well, what are we going to do with it? Are we just going to collect it to keep it in a logbook and never look at it? Well, in that case, it might not be for a reasonable purpose. But if you can identify why you're collecting it, basically to respond to an outbreak, you know, everybody's coming back to work, people work in close quarters, wear PPE, but, you know, risk of transmission is high, that may be justifiable. And I would say, as you would want a policy, develop a policy that speaks to how you're handling this information. Be transparent with your employees. Vaccination status is a very sensitive topic. We've seen lots of people embrace the vaccine. People are lining up and saying, yeah, I'm going to roll up my sleeve. Give me the vaccine tomorrow. I'll take whatever I can get. And we've also seen people shopping for different types of vaccines. We've seen, of course, people that may have a medical contraindication that they can't actually receive a vaccine, unfortunately. So those types of issues are poignant and something to consider. I'd be remiss not to mention we've seen a lot of conspiracy theories around the vaccine. So vaccines have really become a flashpoint. And so as you collect vaccination status, you might not want to ask an employee why they've necessarily chosen to get vaccinated or not, just whether they have been. Because that could impact their personal beliefs and so on and so forth. So really go through this analysis. I would say reach out, get some advice on a policy. We can help you develop a policy. Next slide, please. So as I mentioned previously, I won't go into any great detail on this slide, just particularly in the interest of time, so we can take questions. But when you're collecting vaccine status, if you decide to, these are some checklist of items, right? You'd only want to disclose on a need-to-know basis. So don't have everybody in your company know somebody's vaccine status. You probably want to restrict it to your HR team or even a subcomponent of that team to really manage this information. Obviously, it must be secured. Don't retain it longer than necessary. So usually, that's maybe a year or whenever you don't need that anymore, or when the employment ends. And be sure to protect the anonymity of anybody who hasn't been vaccinated, because as I mentioned previously, you don't necessarily know why they haven't been vaccinated, and that could be due to a medical issue. So that could potentially be discriminatory if somebody finds out their status and treats them differently because of that, as opposed to somebody who's just making a personal choice not to be vaccinated. Next slide, please. So as you're developing a policy on vaccination status, or we're calling it a vaccine information status, be clear why the purpose of the collection of the information, the use and disclosure. So why are you going to use this information? Is it only going to respond to outbreaks, or if somebody requires accommodation? Specify those reasons, be specific, be narrow. And then who can you disclose this information to? Can you disclose it to another employee that's been exposed to this person if they test positive, for example, or report that they have symptoms? Or can you only disclose this information to public health? So you really need to be clear with what you're going to use this information for, how you're going to disclose it, because with any personal information you're sitting on, it's potentially a liability if used improperly, right? Information and data breaches are in the news every week. And so do not treat this information delicately. You have a robust policy in place. And most of all, if you get an employee's vaccination status, we strongly recommend seeking their express written consent. So, they fill out a form where they give you consent to collect, use, and potentially disclose this information. And that also indicates that they've read the policy. And I think that's important to be transparent with the employees as well. So next slide. So another question we've received, a lot of asks about is, can I have a mandatory vaccine policy? And the answer is, right now it's unlikely that a mandatory vaccine policy would be considered reasonable. And that's for a number of reasons, which are both practical and legal. However, this could evolve over time. Like, this could change over the coming months. And we might certainly need to update this and do another presentation if we say, look, now's the time where we think you could have a mandatory vaccine policy upheld. As I mentioned previously, though, too, context is so vital here in terms of what type of organization you are. We've seen a lot of case law out of healthcare institutions, as you would expect, in terms of mandatory testing policies. So that's not mandatory vaccination, but mandatory testing, around rapid testing, and as well mandatory nasal swab testing. And, those usually come out of the context of grievance arbitrations. And arbitrators really look at, is the policy reasonable and does it go further than necessary? And, long-term care homes in particular, where some of those policies are tested, were considered at the beginning of the pandemic the most at-risk environments. And so that factored heavily into those decisions in those particular cases. I do mention that mandatory vaccine policies, you're unlikely to have one upheld by a court or by an arbitrator right now, because vaccines are being doled out by public health or at the provincial level. So employers don't really have control over vaccines right now. And the prioritization is out of an employer's hands for the most part. Right now, supply is increasing, still limited though. You're going to really want to do a key analysis. And if you decide you want a mandatory vaccination policy, I would say definitely seek legal advice on it, because it will be challenged. It will be heavily scrutinized, and ask yourself, is it necessary at this point in time? We might get to the point where mandatory vaccine policies are eventually in place. I mean, I doubt it, but 6 months or a year from now, mandatory vaccine policies, definitely could be more common. What we would recommend doing, and what we've seen clients doing, is rather than mandatory policies, create vaccine incentive policies. So how can we encourage employees to get vaccinated? Give them paid time off, give them the day off after they've got their second dose when symptoms are likely to crop up. Many employers in the States too, you could have seen in the news, they're offering things like gift cards, other things like that. Yes, those potentially create inequities for people that can't be vaccinated due to medical reasons, but it just goes to show the best bet here right now, and what we would strongly recommend, is try and incentivize being vaccinated. It's strongly encourage it amongst your employees. Hold information sessions, try and break down any myths or conspiracy theories that people have around vaccines. So just in the interest of time, I'll move to the next slide. So common questions. And so hopefully this will be a bit of a segue into our question period, but what do I do with employees who refuse to be vaccinated for non-protected grounds? So I want to be clear, somebody that's just simply refusing to be vaccinated, not claiming accommodation or any kind of medical issue. So basically right now, based on public health guidance, the employee can continue working. So depending on your workplace, this may mean that you put them working remotely or in person with appropriate PPE, but certainly you can't say that they cannot attend work because they haven't been vaccinated. You may want to put temporary work restrictions in place depending on a case-by-case basis. Perhaps if they work closely with somebody who's also back in the workplace who has a medical condition that could be significantly exacerbated with COVID, you want to put some modifications around their work location in place, or plexiglass barriers, those types of things. So it's largely a case-by-case analysis right now, but can you flat out refuse to allow somebody to return to work who hasn't been vaccinated right now? No, because still a large percentage of the population isn't fully vaccinated, and public health has said that the measures of wearing masks and socially distancing are still adequate. Then the second question we received is, can employees refuse to attend work because other employees are not vaccinated? So similar to the first answer, you would need to know if this is an accommodation request. If it is an accommodation request, our previous guidance needs to be taken around assessing, okay, can we look at having them work from home in the interim? If it's not an accommodation request, but rather a personal belief of the employee simply saying, I don't want to come back to work until everybody's vaccinated, which actually may never be the case, right? Not, 100% of your employees may not be vaccinated. You're going to want to remind them that public health measures say, we'll come back to work, definitely we'll have masks, appropriate PPE, hand sanitizer, distancing measures are in place. If they refuse to return to work just because of people not being vaccinated, drill down, can you accommodate them? Can you do a gradual phase to return to work? You don't want to necessarily lose good employees, but similar to what Megan spoke to around constructive dismissal, if an employee simply refuses to return to work in person, that eventually might constitute a job abandonment. So definitely I would say, if somebody's flat out refusing and you've provided them adequate notice that they've returned to work, definitely seek legal advice in terms of what approach to take with that employee, because they certainly might definitely take an accommodation approach at some point as well. With that, I'll turn it back over to Laura to answer some questions.
Thanks, Lennie. So now we're going to open up the floor for some questions. And while you're sending in some of the questions, we wanted to address those that have already filtered in. So we received a question about if a province states that masks are no longer needed, such as Alberta, but the organization wants to maintain a mask policy is that allowed if employees are working in the office? So Megan, what are your thoughts on this question?
So my easy answer to this is yes, you can still require employees to wear a mask, even if the provincial guidance changes. And in fact, in some situations, you may actually still have an obligation to do that to satisfy your health and safety obligations that Lennie looked at earlier. So just because a province is lifting public health requirements doesn't mean COVID's going to disappear. So, between 11:59 one night and midnight when the restrictions lift, it didn't go away. It will still be there. You can still impose mask requirements in your workplace if you need them. We've seen this in the US with workplaces. States lifted it state by state. People thought it was too soon. And so they still required them until each kind of organization felt that it was okay to start lifting some of those requirements based on what happened after those restrictions were lifted.
And so we got another question about testing. And the question is, can employers ask employees to take a rapid test before returning to the office? So Lennie, what do you have to say about this question about rapid testing?
Yes, thanks, Laura. So it's a great question. And just for everybody's understanding, so there's two types of COVID testing. For the most part right now, you have nasal testing, which is the long swab where they go, I think it's first in your mouth and then your nose, just to get all the sections. It's this long sort of 9-inch swab that takes roughly a day to be turned around from the labs. There's also what's Laura referred to as rapid testing, which gives the results within minutes. Based on my understanding, the results aren't nearly as accurate as the nasal swab. However, it's so much quicker that it's easy to identify positive cases and quickly isolate them. We've seen some guidance from labor arbitrators around rapid testing right now. So in the context of a long-term care home, a union challenged an employer's rapid testing policy. So an employee would come to work and have to take a rapid test. The arbitrator said, look, any form of COVID testing, yes, it's invasive to some degree. It's in your mouth or your nose. That's invasive. However, when you weigh that invasiveness against the purpose of the employer conducting the rapid tests for the health and safety of staff, but also of these very vulnerable residents in a long-term care home, that outweighed the invasiveness. So in that context, in the context of a long-term care home, rapid testing has been found to be valid and reasonable. We've also seen another case involving a labor arbitration of rapid testing on a construction site being found to be valid. Now, again, very context specific. The facts of that case seem to indicate that on that particular site, people were working in close quarters and whatnot. So I imagine that influenced the arbitrator's decision very, very heavily. I would say that you might have less of a chance of having a mandatory rapid testing policy upheld in an office type environment where people can socially distance or physically distance much easier. You have designated workplaces. When you get up from your desk, you're always wearing your mask or never taking it off. That might not withstand scrutiny. What I would recommend in those types of cases, if you're not in an environment where rapid testing is likely to be upheld, make it voluntary, incentivize it, allow employees who want to do it, and create almost that peer pressure to say, look, I'm doing it today, you do it, let's all keep each other safe and healthy, and just instill pride in your employees to be tested, make it available, make it easy. That's probably your best route for rapid testing. Again, it's not the most effective, and so it might not withstand scrutiny in an environment where there's not a vulnerable population that your organization is serving, or if your employees aren't working in close quarters. So I hope that answers the question.
Thanks, Lennie. And so we also got a question about, with schools in Ontario offering virtual or in-person learning, does an employer have to accommodate those who have already either elected virtual learning or those who will elect later this year and allow them to continue working from home remotely? So as with all human rights accommodations, including those related to family status, it's very case specific. And those circumstances will involve perhaps whether the child has a particular disability or is at risk of, or is, sorry, at higher risk of contracting COVID-19 due to an underlying medical condition. And as well, we do note that the Pfizer vaccine is the only vaccine currently approved for those under 18, and it is specific to children aged 12 to 17. So keep that in mind, that there will also be those who have children under the age of 12 who cannot get vaccinated. And as I explained earlier, the undue hardship is a very high threshold. So if an employee was working remotely successfully during the pandemic period, and they're asking to continue to work remotely for a certain period of time to accommodate this virtual learning, it probably will be quite difficult for an employer to argue that this work from home accommodation is not suitable or would amount to undue hardship. So that's our time for today. We want to thank you all for attending, and we look forward to answering any additional questions that you may have that either arose from something you heard today or that we didn't get a chance to discuss. And thank you again to my panelists, Megan Beal and Lennie Lejasisaks.